All right, let's go ahead and get started. So welcome everybody. I'm so excited to have this event today. Good morning, good afternoon, and good evening, depending on where in the world you are. So my name is Greg Willenius. I am a professor of environmental health here at the BU School of Public Health. And I am really excited to be here today because we have a wonderful program, and I'd like to take the opportunity to make a special announcement. So today, I'm pleased to announce the launch of the new BU School of Public Health Center for Climate and Health. As we'll discuss more today, climate change poses an enormous threat to virtually every aspect of our health and well-being. But climate change also poses an unprecedented opportunity to enable and improve our communities. The mission of the new BU School of Public Health Center on Climate and Health will enable communities around the world to be healthier, more equitable, and more resilient in the face of continued climate change. The center builds on the existing success and expertise of more than 20 faculty, staff, and students already at the School of Public Health, leading research, translation, and practice focused on this important topic. The new center will specifically further coalesce this growing community at the school and across the region, will provide resources and expertise to catalyze new cutting-edge research and effective translation of that research into practice, and provide visibility to this great work in order to position the School of Public Health as the clear academic leader in this space. I'd like to take a moment to thank Dean Galea and his team for his vision and leadership in creating this new center. And I'm so looking forward to what we can do as a community together to address this problem. So for today, the agenda is to leverage some of the great discussions that took place a few weeks ago at a live event. So we have some of the videos from that event. We've stitched them together to address particular topics. Specifically, we're going to show you a video summarizing the impacts of climate on people's health today. So this isn't an existential threat in the future or to some other people. This is a threat to you today. We're going to talk about how climate change is an issue of health equity. And then we're going to focus a little bit on progress and solutions. And to help me guide that conversation today, I have Professor Patrick Kinney and Professor Amruta Nori-Sarma, and I'd like to introduce or allow each of them to introduce themselves. So Amruta, why don't you introduce yourself?
Hi, good morning, good afternoon, good evening, everyone. So excited to join you for this event today. I'm Amruta Nori-Sarma, and I'm an assistant professor in environmental health and also biostatistics and epidemiology data analytics center here at BUSPH. And I'm very thrilled to be here today to join for this conversation. So thank you.
Thank you for being here. And Pat?
Hi, good morning and good evening, everyone. Pat Kinney, I'm the Beverly Brown Professor of Urban Health here at the Environmental Health Department at BU School of Public Health. And I'm very happy to be part of this. And I wanted to just thank Greg for his leadership over the past 2 years in building towards this launch of the center. I'm excited to hear the discussion today.
Thank you. And again, so we're going to start with the first video, and then as you see the video, just go ahead and put questions in the Q&A so that we can have an interactive discussion, taking the conversation where you want it to go. So with that, maybe we can start the first video.
And we've set a goal of reaching 1 billion people with resilient solutions to climate impacts by 2030. And we specifically work on heat. And as has been said, it's the #1 killer of climate impacts, silent killer more than any other climate hazard. And it's quiet and it's not dramatic. It doesn't have an agency that owns it. It doesn't have a name. It does not have a season. And the 1,000 plus death toll from the Pacific Northwest heat dome is remarkable. And as I've seen by Chris EBI called a mass catastrophe event. And that's what this is. And that is the US in a developed context. And it's quite stunning. And so we have made it our mission to bring the actionable awareness and solutions to extreme heat through the build of a global coalition of which Greg Willenius is a member and a leader in, and through some specific interventions and actions that I want to tell you about. And I want to make sure we can follow up for those who are interested, but the Chief Heat Officer in Miami, Jane Gilbert, is our partner, and it is our organization that launched the Chief Heat Officer concept in Miami. You see that proliferating, which is wonderful. And we have one in Athens and one in Freetown, Sierra Leone. We just announced the metropolitan region of Santiago in Chile, and we have one coming up in 3 weeks in Mexico and next to Oceania. And so we want to have one as a representative on every continent this year. And what comes with that, the symbol of the single place that sits very close to the leadership of a community with a heat health task force and all the tools that you need to understand the size and the nature of the heat risk and impact, starting with the most vulnerable communities. We have built out of the Extreme Heat Resilience Alliance 4 working groups that capture the highest priorities from the community, from the incredible work that already exists and has been going on for a very long time. And we want to give it the oomph and, pardon the pun, put some fire under all of it because of the urgency that it faces. And, you know, the show Game of Thrones, winter is coming. I'm getting rid of that and going with summer is coming, but it's not summer. It's really heat season is coming, and it's coming on this side of the planet, and still happening in the southern hemisphere. And so it's happening every day, all the time. And the faster we can do this, more quickly we can do this, the better. And so those categories are building awareness for decision makers linked to vulnerable people. The awareness piece is the gap is so remarkable, which I know you all are well aware. The second is good policy. We've contributed to legislation that's been filed in California that is categorizing heat events, naming a chief heat officer for the state of California. That's Assemblywoman Luz Rivas and her partners and co-sponsors there. And we are excited to see that opportunity for more legislation at the local level. There's some things happening in Miami-Dade County around worker protection. We're understanding the economic impacts to bring policymakers into the issue. We partnered with Vivid Economics to assess the cost of worker productivity loss to the US economy. And in 2020, it was $100 billion, doubles by 2030 to 200, and then to 500 billion to $500 billion by 2050. And of course, those numbers and that loss is not borne equally. It is borne more by the southern states of the US and by people of color and by Hispanic people working outside. And so we are now underway on a 13-city analysis of mortality and economic losses due to worker productivity impacts of heat, and we'll be rolling that out in June. And so a good look across the globe, very different cities: Dhaka, London, Delhi, Freetown, Athens, Monterrey, Mexico, Abu Dhabi, Santiago. I think you get the idea. Very different. Bangkok. And so back to the categories: policy, talked about that. Risk and finance. How much does it cost to have a heat event? Get ready for one, recover from one. We don't have the data that we need to fully understand that. And can we bring the understanding along with some financial strategies that don't tap the coffers that are already so stressed from COVID and everything else that's happening right now? And so we're working on understanding how we can deploy finance and risk transfer to help communities deal with this. And then lastly, interventions. What can we do? Lots of things we can do. Green roofs and cool roofs, and the things that you saw in the first two presentations, urban forests, cool roofs, change the design. We know that the urban heat island effect is not helping the way we've built and are continuing to build our urban areas. So lots we can do. And we are beginning to put a concept of a capital stack of investment into things that cool communities. So we can do it at scale, aggregate projects across those 13 cities. And so it's early days, but go from awareness to understanding it, to measuring the risk, to identifying where the most vulnerable are, and then identifying those interventions, and then attracting capital, and all toward the COP27 in Sharm el-Sheikh, Egypt in November. So we're in a hurry, and summer is coming.
So the other element, I think the other very interesting research program that I've been able to learn and enjoy in collaboration with my colleague at BU is really to looking at the health impact of heat warning systems. So when we're dealing with protecting our health with climate change related disaster, so what type of intervention work? What can we do? So Kate Weinberger, who is a member of the team in the lab with Greg Willenius, so she's been conducting a very successful research of looking at the health impact of heat alert system. And quite disappointing, she found in this really interesting work that heat alerts were actually not very effective in lowering the risk of that. Were somewhat effective in lowering the risk of hospitalization for heat stroke. But again, there was not really, actually, I'm sorry, let me say it back. Not they were effective, they were the opposite. They were associated with a higher risk of hospitalization and heat stroke. So basically, what's going on here? So are these really heat alerts not useful and actually could be harmful? And so this is part of a very interesting investigation that is led by Zhao, who again was, as a member of the team led by Greg Willenius on a joint grant that we have together, which is really try to address from a causal inference perspective, how many deaths we could have been avoided if we change the frequency of heat alert. So actually, this is in the context of really data science and causal inference, is in the context of what we call stochastic intervention. By stochastic intervention, what we mean about is really an hypothetical intervention. So basically, what we want to answer the question is, how much more often do we need to increase the number of heat I need to alert to see a protective effect on health. So Zhao is leading a paper where basically I can just show it. It's highly technical, and I can show you with data, right? So basically, what this picture shows, these are the heat. With the blue cross are identified days where they were issued heat alert in Los Angeles County during the period 2006 and 2016. And so what Zhao is doing within a highly rigorous causal inference framework and a stochastic intervention is asking the question, okay, now if we think different counterfactual, so different alternative hypothetical scenario where we increase the number of heat warning, how are we going to see an health impact? So this is like an hypothetical counterfactual where you see that the number of days where we are issuing an heat alert is much more frequent. And what he's finding, for example, when he does a county-specific analysis for many different counties in the United States, then in some counties this heat warning alert can be more effective than others. So, for example, in the Maricopa County in Arizona, we need to, if we increase the frequency of it alert substantially up to an odds ratio of 2, you see that you start seeing a positive effect on preventing number of deaths. That would be much less effective in New York. And that is really important because it's not only to address the question, how many more heat alerts we have to have, but also that, as we all know, there is a differential heterogeneity and vulnerability across the United States in our ability to respond to this heat warning system.
Great, thank you. So I love those clips because I think what they show us is both sort of at the, in academic science that heat is bad for our health and that it's a really tough problem in terms of solutions. And then, Kathy's perspective that, real cities and towns across the world, this is a problem that, community leaders are really struggling with and trying to figure out the best ways forward and sort of seeing that tremendous amount of innovation. But let me just step back a bit and Pat, maybe I'd like to start with you. Just tell us a bit more about, the health impacts of extreme heat. Is this help us contextualize this into a big problem, a little problem, a theoretical problem, a real problem. Help us put a little bit of meat on that.
Thanks, Craig. Yeah, I think as the comment about the heat dome in the Northwest made clear, it's definitely a big impact. Extreme heat in the warm season has been a risk factor for premature mortality for decades. But the trouble is those extreme events are getting much more frequent and longer in duration, and so the risk is going up. We can quantify the impacts on increased death rates throughout different cities in the United States, but also globally. The famous 2003 Western European heat wave has been estimated to have maybe killed as many as 70,000 people prematurely. So it's really a tangible impact. And I'm just focusing on the mortality part, which is the one that not only catches our attention, but it's also most easily measured in some ways. But I'm sure that the evidence is now emerging on a range of other health impacts short of death from extreme heat. And I think that's important for us as epidemiologists and as public health people to understand not just the mortality impacts, but also the morbidity impacts. And just one final comment, who's being affected? Well, we know that especially it's elderly folks, often poor people in cities who don't have access to resources to both social resources as well as cooling resources to help them get through heat waves. But it's not just them. It's also outdoor workers who have to work through the heat wave. Those folks regularly die during heat events. Children as well, unfortunately, are sometimes affected. So it's a widespread problem, and it's getting worse, unfortunately, with climate change.
That's great. Amrita, let me turn to you a bit. Can you build on that? Because I know you've done some recent work looking at the mental health impacts of heat. And I think this, maybe is surprising for people. So there's these impacts not just on our physical health, so mortality, and then as Pat is just alluding to, other, effects on illness and well-being more broadly. But tell us a little bit more about the mental health impacts that you've found.
Thanks so much. Yeah, that's a great question. So we do, as Pat has mentioned, we know a lot about the physical health impacts of extreme heat exposure. And, we've known for decades that it leads to premature mortality, as he's mentioned, and also a host of physical health outcomes, which, our research is also focused on. But recently, I've become really interested in this concept of how does, extreme heat and how do increasing ambient temperatures impact mental health. And what we've found in our recent work is that for all mental health outcomes, as well as for specific outcomes, including things like mood disorders, stress disorders, anxiety, schizophrenia, self-harm, we see increasing rates of visits to emergency departments across the US that are associated with increasing summertime temperatures. And it's really interesting because we see similar consistency in the rates of these emergency department visits, regardless of what the mental health outcome is that we're looking at, which kind of indicates to me and to others in our group that extreme heat is an external stressor that is exacerbating existing adverse health. So people who are particularly vulnerable during times of extreme heat may be those who already have underlying mental health conditions that are being stressed, particularly during these summertime periods. And that's really important for us to know in the context of climate change. We can expect, as Pat mentioned, that these summertime extreme heat periods are just going to become more frequent and possibly even more severe given climate change. And so we might expect increasing rates of visits for mental health to emergency departments, in addition to the host of different physical health impacts associated with extreme temperature.
That's great. And let me stay with you for another second. You know, I know you've done some great work in India in terms of in the solutions space. And you've also published some papers in other parts of the world, I think, including New York City and South Korea on solutions. You know, if we know that heat is so bad for people's health, is such a threat to people's health, tell us a little bit about why this is such a challenge to address at the population level and what you've seen in your experience, maybe even what works.
Yeah, that's a really great question. And I think that, the number one thing is trying to identify, as Pat mentioned earlier, who are those populations that are the most vulnerable to the adverse health effects that are happening during these periods of extreme temperature. And how do we really start to access those people? How do we get the messaging to them? How do we make sure that they know what resources they have available during those times of extreme temperatures? And how do we make sure that they're able to use those resources in the way that they're intended to be used? So, some of the things that we've seen that really do work are awareness campaigns conducted in local languages, heat wave text alerts, things that really are targeting those populations. And one of the things that I think is really important to keep in mind is that vulnerability, especially in those populations that are elderly, vulnerability among children, these are things that require very specific activities in order to make sure that those people are receiving the message. And one of the best things that we know can help during periods of extreme heat is actually air conditioning, but it's just not feasible in some populations, for example, in India, to have access to consistent air conditioning in places where they don't have baseload electricity capacity. So it's also about tailoring the interventions to the different communities and their own needs. So for example, rather than recommending air conditioning usage, recommending visiting green spaces in urban communities to make sure that you're able to access cooler areas during those high heat periods. So I think, the primary things I would say is, one, making sure we understand who's the most vulnerable, and two, making sure that we know what are the activities that are most developed in the context of the community that needs them.
That's wonderful. Thank you. It's unfortunate that there's not an easy one-size-fits-all solution that we can just sort of out of the box take this solution and apply it everywhere and it would work. So Pat, we've been talking a lot about heat, but I just want to quickly acknowledge that there are a number of other ways in which continued climate change threatens our health and well-being. Can you just give us a quick overview of sort of what the kind of main events are, the other main hazards, and how they're potentially linked to health? Just a couple examples.
Yeah, sure. Thanks, Craig. We often focus on temperature when we talk about climate change because it's the most obvious and easily measured sort of manifestation of climate change. But I think of temperature as kind of like with body temperature, we use the thermometer to see if we're healthy or not, if we have a fever. But there's lots of other sort of complex processes going on besides just the fever. And I think the Earth system is also quite complex, like our body is. So there's lots of other things happening. For example, extreme storms. We know that the intensity of hurricanes is getting greater, which is having larger impacts on coastal communities in the U.S., but also throughout the world, where typhoons can have impacts. There's changes in air quality that we've analyzed and shown that climate change can make air quality worse. There's also a whole range of infectious diseases, especially ones that are carried by vectors like mosquitoes, whose ranges are very sensitive to temperature as well as to precipitation, which are alarming. We had the scares about the Zika virus a couple of years ago, and I think we're going to see more of those. So those are just a couple of examples, Greg.
Okay, great. Now we'll dive into those. Let's maybe go ahead and play the second video, focusing on climate change as a health equity issue.
This is a graphic from the recent Surgeon General's report on the mental health well-being of young people. And I share it because we are in the midst of a crisis now that's fueled by many things, COVID being a very strong force, the isolation and the anxiety associated with COVID. But this is just a graphic showing the different contributors that are coming together to affect the mental health, especially of children, young adults, adolescents. Notably, it's hard to see, but when we look at the environmental factors, climate change and natural disasters are for the first time noted by the Surgeon General as being an important aspect of the stressors that are contributing to this mental health crisis we're in. So just another piece of what's going on. But, I also want to look at the top box and just note again that the mental health stressors affecting children are compounded, and there's intersectionality with the stresses that would accrue from social economic inequality, from discrimination, racism, from the migration, which is a secondary effect in many cases of climate stress, as well as political upheaval and just economic opportunity. And then, of course, in the bottom at the individual level, we have individual vulnerability factors that are intersecting there, ranging from race and ethnicity to gender and sexual orientation. So all of these things can be cumulative and intersectional in causing these health effects. And we have to think about, what do we do today to be able to make those individuals resilient in the face of these compounding stressors. And this is just another depiction of this. Again, a slide borrowed from colleagues at the CDC. And I just share it. I'm not going to speak to it. I just spoke to it really, but showing that what's going on in terms of who is suffering the most from current climate variability, the recent Asian immigrants in the basements, the indigenous people in the Northwest who lost the cockles the clams and the cockles from the heat wave that killed millions of crustaceans and seafood on the shores. That's part of their cultural identity and part of their food. That this vulnerability is grounded in the same thing that we've been talking about for decades with environmental justice, with where people are in many cases not given choices, where they have to end up living for economic reasons, where things are sited in their proximity, where the investments are made in their communities, and then the root causes in those social forces. And I'm just going to keep going with this and share an example, again, a visual example for the visual folks in the audience. There's been a lot of study in the last few years about the systematic nature of financial discrimination that's known as redlining. It comes from the practices of something called the Homeowners Loan Corporation, which worked with the federal government to create over 200 maps of urban areas in this country in the 1930s and 40s, in which neighborhoods were outlined and graded on a 4-color scale based on their financial risk. Green being the lowest financial risk, red being the highest, and yellow the second highest. And so the practice of drawing lines around neighborhoods and then shading them red was called redlining. And it is easily demonstrated that the areas that in the 1930s and 40s that were designated as high financial risk were disproportionately lived in by recent immigrants, by African Americans, by Hispanic Americans, and other people of color. And there's a wealth of epidemiology now showing that those areas that were redlined, which immediate economic consequences were deprivation of low interest loans, often not able to get mortgages, systematic lack of investment in infrastructure, et cetera, that those areas are now found to have higher rates of most chronic diseases, preterm births, et cetera. And this is just a depiction of the city of Richmond. You can see to the northwest, to the left there, that's mostly green and blue. That was the wealthier white area. The eastern part there on the right side is redlined. That was the predominantly African-American part of Richmond. And an analysis has been done from a climate change standpoint. So this is a map showing the green cover. And you can see that the left side there, the west end, has a darker green coloring, indicating more green cover. The right side has more impervious surfaces, which not only are heat trapping and radiating and causing higher temperatures, but also affecting runoff, wastewater overflows, water quality, and flooding. This is a map actually showing paved surfaces, showing the same thing. Lighter color, less paved surfaces in the green area, darker gray, more impervious surfaces in the red areas. And this translates into the average summer temperatures, which are blue, cooler in the green lined areas and red in the red lined areas, indicating greater exposure to heat. So just one manifestation of a link between social equity, climate change, and health equity.
So in 2006, there was a proposal to site a dirty diesel peaker power plant on the banks of the Chelsea Creek. The very same proponent who was proposing clean, renewable energy for Nantucket was proposing a dirty diesel power plant on the banks of the Chelsea Creek. That company, Cape Wind, was not telling anybody that they were proposing this dirty diesel power plant on the banks of the Chelsea Creek. And yet when residents got wind of this proposal, we started to do everything in the organizers' playbook. We protested. We showed up at their offices. We wrote letters. We had children writing to politicians. We engaged pro bono attorneys and licensed site professionals. And one of the most important things that we did was we partnered with folks at the BU School of Public Health who helped us to really understand and synthesize these large technical reports about air quality and what they were essentially masking when they were saying, we're not really going to be polluting that much. The folks at the BU School of Public Health helped us to dig through those reports to see actually they're lying about their numbers, and their numbers are much more significant than they're showing. And ultimately, we were successful in stopping that power plant. And so this is what the playground looks like right now. Without those horrible stacks looming in the background. Now our children who are at this public school in grades 1 through 4 can play without worrying about hazardous, the addition of new hazardous air pollutants in our community. We're seeing in communities like Chelsea that have so much impervious surfacing, so little green space, such a low tree canopy cover, so much density and so much vehicular pollution that as the temperatures rise, communities like Chelsea are getting hotter and hotter. Studies show that communities like Chelsea have upwards of 40 degrees hotter neighborhoods, areas than in other communities. One of our young people, also doing community mapping, showed that he took the temperature of a park bench just last year. It registered 130 degrees. 130 degrees in some of our most utilized parks. How could we possibly close our eyes to these long-term impacts of heat and heat island impacts, which only exacerbate public health, cardiovascular disease, respiratory disease, and more, dehydration. And so we've been partnering with the City of Chelsea and the BU School of Public Health on a project called Sea Heat. And what we're essentially doing is we're monitoring outdoor temperatures, but also monitoring the impact on individual folks. What do you feel like when it's hot? Where do you go? How do you experience heat? Where we have personal monitors with folks, and we're also using photo voice to have folks take pictures of what is it like? What does it mean to them? Where are they when it's hot? Where do they go when it's hot? What do they see? What do they feel? And this map shows you some of the emerging heat islands. So we consider all of Chelsea a heat island, but even within Chelsea, there are neighborhoods that are hotter than others. And so one of these heat islands just underneath the Chelsea map, if you could see my cursor, I'm sorry, just over here, we're actually implementing a coal block strategy. Oh, sorry. Forgot that this is animated and shows you all of the heat sensors. But we're implementing a cool block strategy, and we're, again, taking this sort of as a pilot. We're taking one block and intensively implementing strategies. We're doing tree planting around the entire block. And if anybody is in the Boston area and interested in joining us, we're starting tree planting on Earth Day, April 22nd, with a group of volunteers. And if you're interested in joining us the next day, we're doing a community cleanup on the 23rd, so you can message me for more information. But essentially, we're putting block-wide tree planting. We're looking at the Boys and Girls Club and partnering with them to install a white roof. And we're reimagining this lot right here, which is right now partially paved and partially just underutilized sort of gravel. And together with the community, we've come up with designs and visions for what this site will look like when we turn it into a lush green space. And so we're monitoring the before and the after to show, hopefully, that our theory is correct, that this block will be much cooler after this intervention is put in place. And we're very excited about this project, again, partnering with BU School of Public Health.
Great. So what I heard there is that climate and heat in particular, but these climate hazards impact everybody or have the potential to impact anybody, but that some people are disproportionately bearing the brunt of that impact. So, Pat, can you maybe just give us a bit more context about sort of what you think are the sort of population scale or neighborhood scale factors all the way down to the individual factors that make communities or individuals more vulnerable to the impacts of climate change?
Yeah, thanks, Greg. I think part of it is exposure. Whether we have, a person or a family has the resources to limit exposure based on their housing, based on how they get from point A to point B, from their home to their work. Do they have the resources to pay for air conditioning and pay the high energy costs of air conditioning? So can you mediate your exposure or not? There's also, I think, vulnerability factors that have to do with kind of access, baseline health status and access to health resources, which also are quite limited in underprivileged communities, less access to routine healthcare, which leads to sort of higher baseline levels of morbidity, which means that when heat comes and you're exposed to these higher levels, you're also more vulnerable because you have pre-existing health conditions. And I think it's really important to also mention sort of being elderly and being ill and relatively immobile. I've known from my own parents as they've gotten older that mobility becomes a real issue. Being homebound, maybe being stuck, folks who are stuck in apartments that are in upper floors, where the heat from the sun is really heating the upper floors of the building. So sort of those kinds of issues as well. Cities often create cooling centers, in an attempt to provide cool places during heat waves. But if you're not sort of able to get to the cooling center, that doesn't necessarily help you very much. So those are a couple of factors. I wonder if Amrita has other, or I'll turn it back to you, Greg, but I think Amrita studied vulnerability more than I have.
Yeah, no, Amrita, I do want to hear from you, and in particular, how some of these factors sort of superimpose on each other. So, these factors aren't these vulnerability factors aren't completely independent from each other. So can you maybe just build on Pat's perspective there and also sort of on how the cumulative vulnerability or cumulative impact, how you see that?
Yeah, so I think that's a really great question. And, Pat's mentioned a couple of the major things that we think about in terms of community level factors that indicate vulnerability. And maybe I just want to take a step back and mention that one of the reasons why we think of climate change as an issue of environmental justice is that the communities that are disproportionately impacted by these climate events that we're talking about, whether it's heat exposure, storms, or other types of climate relevant extremes, aren't necessarily the communities that have benefited from the anthropogenic activities that have generated climate change in the first place. So I think that's one of the major points that we need to highlight here as a vulnerability and as a justice issue. But, kind of carrying that conversation forward a little bit, there are these really interesting interactions that we see both from the exposure perspective as well as from the outcome perspective that can lead to, additive or even multiplicative impacts of climate change. And one of those is when communities are exposed to multiple adverse environmental exposures simultaneously. So, a great example that Roseanne talked about in her discussion with us a few weeks ago is the community of Chelsea, which experiences these urban heat island impacts, but potentially also is the site for multiple types of power generating stations and, places that might lead to higher levels of ambient air pollution exposure, for example. And so kind of the combination of these different relevant exposures might lead to, additional stressors in communities that are already quite vulnerable because of their location and because of the existing baseline exposures that they experience in the summer, for example. And then from the outcomes perspective, from the health side, Pat did mention people who have existing health conditions might be more impacted by these climate exposures if they have adverse health impacts that are kind of adding on top of their existing health conditions. I think that another one to think about is who are the populations who we think of as being maybe a little bit understudied, but still extremely vulnerable during these climate exposures. And so one of the ones that I've been interested in recently is, families with young children, mothers with newborns. These are people who might have multiple different challenges that they're facing, and then additionally have potential for adverse health impacts associated with these extreme climate exposures.
That's great. And for either of you, I just want to, John Bulbus spoke about redlining and how that practice led to sort of chronic underinvestment in, particularly in communities of color, and how that legacy lives on today. Can you sort of shed some insight as to, how to, Roseanne talked a little bit about sort of the cool block and how you can, try to ameliorate some of those sort of long-standing underinvestments. But can you just talk a little bit about sort of this just seems like a tremendous impact, a tremendous legacy that we've left behind. Can you just dig into the redlining particularly, and how that chronic underinvestment, how widespread is that across the country, and how do we start to tackle to reverse some of that, to in an equitable way reduce the health impacts of climate change?
Yeah, so maybe I can start with the first part of that, and I'll try to answer the second part, which I think is a really big question. How do we start to address some of these historical disinvestments in different communities? And maybe Pat, I'll turn it over to you as well for your thoughts. But, there's been excellent data resources that have provided information on redlining across the United States in urban communities since the 1920s and 1930s. And what we see pretty consistently is that there has been systematic discrimination for home loans, particularly, and that has led to these areas that are very residentially segregated between different communities. And this is very widespread across the US. So you can see this as far as, from Richmond to Chicago and Detroit, and then across the US South and the US Southwest. So this is something that we can really take a look at across these different communities. And what we see is that the initial rounds of residential segregation that occurred as a result of this redlining practice in the early 1900s has lasting impacts into today in terms of the different types of neighborhoods that exist across these urban communities. And even as these urban areas started expanding into additional parts of the peri-urban and surrounding rural environments, we do see consistent traces of that legacy that continue on into different neighborhoods. And so I think that one of the best ways to understand how we can move forward and try and reverse some of the impacts of this long-standing practice and the long-lasting impacts of this practice is to really target some of these interventions, some of the things that Roseanne mentioned in her discussion, making sure we're taking a look at those communities that have been historically impacted and not adding additional factors that might impact those communities. So making sure that the siting of different power plants or the siting of different chemical storage facilities, for example, or the siting of different types of resources is equitably distributed across different neighborhoods and not solely concentrated in those underinvested neighborhoods around the country. So I'll stop there because I could go on about this for ages, but Pat, maybe I'll see if you have any additional comments.
Thanks, Amrit. I think you probably said it all, but I have maybe a couple of words that I can add. One is that from a scientific or academic research point of view, one thing we've seen in the last 5 to 10 years is an increasing development of things called heat vulnerability assessments, which which sort of map out the neighborhoods particularly in cities that are most vulnerable to heat. Having those, I think, helps us, helps public health officials begin to think about targeting interventions in the places that they'll have the biggest benefit. So that's one thing I just wanted to note. The other thing is, listening to Roseanne, her comments about the cooling strategies in Chelsea, I think that was very compelling, and I think it points out that part of the solution is to sort of shine a light on the places where things are needed. You need advocacy, somebody like Roseanne, or a strong advocacy organization that can not only shine light on the problem but also mobilize action and resources to start to sort of demonstrate how to fix it. I think that a lot of these issues probably are fixable, but it's going to take that kind of mobilization and resources sort of that are really directed at the places where it's most important. I think white roofs, I think tree planting, removal of impervious surfaces. There's sort of a lot of tools in the toolbox that can be applied, but you need to kind of know where to put it, and you need to find the resources and the energy to make it happen.
Okay, wonderful. We have one more video, a short one, so I think we can go ahead and play that.
This 3-city project was focused on understanding how housing characteristics influence heat to better understand health impacts and adaptation behaviors of vulnerable populations across 3 cities, particularly during a concurrent heat wave and electrical blackout. So this project entailed some complex modeling and collection of data from residents living in all 3 of the study cities. And our group in Michigan realized that the best way to effectively collect the data and also impact change in Detroit, which is one of the study cities, was to engage with community members. There was no other way to get the project going. So we adopted a community-based participatory research approach, and I list here some of the key principles, and others have talked about that. I particularly appreciated Roseanne's comments. But the idea of CBPR is that you have an equal partnership between community and academic participants with power sharing and discussion of what's being done. You assess the community strengths that are brought to the research and the dynamics that might affect the research and application, identify priority public health issues and research questions, and design research together, and then importantly, feeding back and interpreting research findings and disseminating and translating that research into interventions and policy.
The last thing is empowering communities to advocate for their priorities. So, some of the things we've learned is that to create healthy living environments requires support and action from scientific and professional communities. And so it requires partnering with communities and trying to live out their vision. They want trees and parks, not just for cooling, but for beauty. And they want a clean flowing river. They want to meet basic needs for safety and food and housing and protection of civil rights. So we learned it's not effective to talk to the neighborhood only about organizing around climate change, as we heard in the last presentation. So I think that, these are really good lessons that all of us need to learn about the top-down, bottom-up cooperation. And finally, and in conclusion, I would say that I see the challenges now to addressing climate change are having the motivation and making the political choices to use the knowledge and technological tools we have to reduce structural and social inequalities. And meeting the basic needs of the communities is really what will dictate the human health consequences of extreme heat and other hazards in the foreseeable future.
That's great. Thank you. So I think, one of the interesting things here, we see climate change as a really big global problem. But here in these clips, what we heard of was sort of very local action, local advocacy. And I know you've both worked at both the sort of the national, the global, and also the very sort of community-oriented local level. So, whoever, whichever of you wants to start, just jump right in. But, I'm sort of really interested by that perspective of this is a global problem, but the solutions are highly localized and the advocacy is so important at the local level. Do either of you want to comment on that?
Go ahead, Amrita. You made I think a compelling comment earlier about the importance of sort of place-based tailoring of interventions. Do you want to say more about that?
Yeah, sure. So I think that, just going back to the conversation that we were having earlier about the implementation and adaptation of, heat warning systems, but maybe extending that beyond just heat to look at all of the different types of climate relevant exposures. I think what I've learned in the context of my own research is that as Greg, as you said, there is no one size fits all solution, unfortunately. And this is very much the type of issue and problem that requires these highly localized, highly tailored solutions to address the particular needs of different communities. And, if we think about it in the perspective of climate extreme events, climate related extreme events, it makes total sense that that would be the case, because if you're in the US Southeast, for example, you might be simultaneously exposed to extreme heat and summertime hurricanes that are happening during the hurricane season. And the needs of those communities that are dealing with more extreme storms at the same time as heat waves and maybe potentially power outages associated with post-hurricane life, it's going to be very different from someone who's living in the Western US who's dealing with drought and extreme heat and potentially wildfires. So the solutions that we implement across these different communities, and this is true whether you're looking in the US or whether you're looking in India and some of the previous work that I've done, or whether you're looking in other global health contexts as well, the solutions really have to deal with addressing these types of issues specific to these communities that need them. And I think that's also why the advocacy component comes in so strongly, because who is it who best knows and understands what the needs are of those communities? It's the members of those communities, and they're the ones who can advocate for their health and the health of their children. And these are the things that people get really passionate about. And these are the things that really make for these excellent community-based and community-engaged partnerships, because we as researchers can come in and say, these are the things we think you should care about, but really it is, what does the community care about? And how can we help to empower them to implement and create the solutions that are going to be relevant for themselves and for their children?
I'm glad you mentioned the sort of community university partnership issue, and you make a very good point about that. I also wanted to make the point that to find solutions, we need sort of the advocacy and the enthusiasm and the local knowledge of communities, but we also need technical expertise, and so that I think that's where a center like ours can be helpful in partnership with communities, is sort of bringing the latest technical knowledge about what works, what's worked elsewhere, and then finding ways to apply it locally. And another aspect of that, this point about the importance of local action that's, I think, really important for us to figure out how to solve, is that the expertise, these especially these partnerships between universities and communities, like the one we have with Chelsea in the Boston area, they tend to be focused in urban areas like Boston, New York. There's a fair amount of capacity, both sort of in the communities, but also in the government, but also at the university level. But if you move out of the city into some of the more rural areas in a state, and this is probably true globally, but let's just use the United States as an example. If you move away from the big cities like Boston, you find pockets of vulnerability that are just as important, but where the capacity is much less. There may not be a university sitting there. There may not be yet a strong community organization. There may not be a public health official who understands climate change. So, the challenge I see is how to take what we learn, sort of where the academic and the community resources are so strong in cities, but then apply it in a way that can be used by the communities that are experiencing these problems sort of out in the hinterland to some extent. So that's something I think, I've seen that challenge emerge over the years, and I think our center can try to think about how to sort of spread our knowledge beyond just the urban communities where we're working.
Yeah, that's great. I just wanted to pick up on one thing that you mentioned, Pat, which I think is really an important point, which is that people talk about climate change differently depending on where they are. And so one of the things that I think is also really important to this question is coming to people and providing the expertise and providing the knowledge in terms that different vulnerable communities can understand. I've had conversations with very wide-ranging communities, including traffic policemen at intersections in India, and they may not understand climate change as a larger concept, but they certainly know that they're experiencing adverse health and that it's associated with the fact that they stand in the middle of an intersection for a few hours every day directing traffic. So I think one of the important things to pick up on in what you were just mentioning, Pat, is bringing the knowledge and the expertise that we have in our center to those different communities on the terms that they understand and can integrate into their own lives.
That's great. So thank you both. I think one of the things that I constantly see is that the news media is dominated by sort of our failure to act as on the global stage, our failure to act, or insufficient action on the national stage here and elsewhere, and but there's so much going on. Like I'm actually, hopeful because there's so much action going on at the local level that often doesn't rise sort of to that national, news media. Do you, Pat, let me start with you. Do you agree with that? And how important do you think is sort of the sum total of the local action?
Well, yeah, especially in the United States, local action has been really leading the way on climate change in the absence of federal leadership over the last couple of decades. When I came to BU 5 years ago, one of the sort of central motivators of my work sort of going forward was to sort of figure out how do we capitalize this energy that's happening at the city level. Boston was a good example of one of the cities that was taking a leadership position in climate action. New York City, where I'd been before, was similarly a leader. So I think the action is really at the local level, at least in the U.S. I hope that, I think there's a groundswell of sort of capacity building that's happening. I hope it eventually percolates up to the federal level. We haven't seen that yet. So that's one perspective. Turn it over to you, Amrita, if you have another.
Yeah, Amrita, give us a sort of your, what gives you hope that this is a really large problem with really, important progress?
Yeah, so I think that, in the decades now that I've been really interested in trying to understand the issue of climate change and what are the problems that we face and what are some of the potential solutions, the thing that really gives me hope is that it's no longer a question of if or when, but what do we do now? I think that people are really understanding the sense of urgency around climate change as a global issue that is impacting us not in the future, not at some theoretical future timeframe, but where we can see the tangible impacts of climate on our lives today. And so I think that's the thing really that gives me hope, is that people are really focused on how do we address these issues equitably and how do we start to understand the needs of different communities. And people are really gaining the ability to speak for themselves and to participate in this conversation and advocate for the things that they need in order to make their own lives healthier. And as I said before, the lives of their children healthier. And so that's what really gives me hope. And I think that the continuation of, important programs like our new Center for Climate and Health, which can kind of work at the intersection of bringing the expertise on the technical side to the implementation of different interventions to try and reduce the impacts of climate change, and also continuing to evaluate the effectiveness of those interventions. Do they work the way that we think they should be working? Who are they impacting? How are they impacting the most vulnerable communities? And how do we do a better job of it? I think that process of iterative evaluation of these different programs to try and mitigate the impacts of climate is really an important component as well.
Wonderful, a great positive note to end on. We are out of time, unfortunately. It's been a fantastic discussion. Thank you, Professor Amruta Norisarma and Professor Pat Kinney, for your time this morning and your insights. Thank you all for participating today. I want to also extend a warm thank you to Meredith Brown and her team in the Dean's Office for enabling and advocating for these events so successfully. And I want to thank the Dean's Office. If you missed it at the beginning, our announcement was the creation of a new BU School of Public Health Center for Climate and Health. This is a wonderful opportunity to bring together existing and growing community of climate and health researchers at the BU School of Public Health and the broader community, and to enable us to do even greater things together. So thank you to the Dean's Office for supporting this initiative. Thank you to the Dean's Office for organizing today. And thank you all for being here. I look forward to engaging with you again soon.